So we have what is known as what the Adrenocorticotropic Hormone Stimulation Test. So I think it has a second name, which is known as what the Cosyntropin Stimulation Test. Adrenocorticotropic Hormone Stimulation Test. Cosyntropin what stimulation test. So this test is used to what access the function of what adrenal glands by evaluating their response to what an adrenocorticotropic hormone that is synthesized. Do you understand? Like a secondary source, bringing something from outside to see how the indigenous one will actually react to it. Okay. So the principle is to say that the adrenocorticotropic hormone is what produced by the pituitary gland. That's that stimulate the pituitary gland to what produce cortisol. So that stimulate the adrenal glands to produce cortisol. So this test involves what administering an artificial adrenocorticotropic hormone. So as you are administering it, you are now what trying to see if the levels of cortisols will increase in the body and to what extent. Okay. So procedure, we have the baseline measurement where a sample is taken to measure the baseline levels of cortisol. Injection, now the artificial adrenocorticotropic hormone, which is known as what cosyntropin. That's why they say another name for it is cosyntropin stimulation test. So you now what give it to the person, and it could be what through the muscles or through the veins. Okay. So after giving the injection for you leave it for about 30 to 60 minutes, then you measure the cortisol levels. So for interpretation, for normal response, normally you gave something that should trigger something, so there should be increase, right? So if there is adrenal insufficiency, that's Addison's disease, there will be little or no increase in the cortisol levels. Okay. Then the secondary adrenal insufficiency. This one, there's an insufficient response to the adrenocorticotropic hormone. So it may indicate a problem with the pituitary gland or hypothalamus. Okay. So clinical significance, it can be used to diagnose what adrenal insufficiency, diagnose Addison's disease, monitor the functions of the adrenal gland, then evaluate what the HPA, that's hypothalamic what pituitary adrenal axis. Okay. So I think basically that's it for this type of stimulation test which is done, right? A type of dynamic biochemical test used to what evaluate conditions of the endocrine system.